Did you know doctors can often spot serious health problems in seniors before a single word is spoken? All it takes is one glance at your skin, your nails, your breath, or even how often you bathe. These seemingly normal hygiene habits, things most people do every day without a second thought, might actually be silent red flags for serious medical conditions. And what's truly frightening? Most older adults don't even realize they're making these critical mistakes. In the next few minutes, I'll reveal 7 personal hygiene mistakes that doctors notice immediately in their elderly patients, and how correcting them could help you avoid dangerous, even life-threatening, conditions. This isn't just about cleanliness. It's about protecting your heart, your brain, your immune system, and your independence. So if you're over 60, or love someone who is, this may be the most important video you watch all year. Mistake number 1. Neglecting oral hygiene. When was the last time you replaced your toothbrush? Do you brush thoroughly, twice a day, every day? If you're like many older adults, the answer might be not recently. But here's what most people don't know. Poor oral hygiene isn't just about cavities or bad breath. It's directly linked to heart disease, stroke, and even dementia. According to research from Harvard Medical School, bacteria from gum infections can travel through your bloodstream and inflame vital organs. In fact, seniors with untreated gum disease are 3 times more likely to develop cardiovascular issues. Let me tell you about Sylvia, a 8-year-old retired teacher. She brushed daily but ignored her bleeding gums. During a routine exam, her cardiologist discovered dangerous heart valve inflammation caused by oral bacteria. She later said, "I thought gum problems were just a part of aging. I had no idea it could threaten my life." What can you do right now? Replace your toothbrush every 3 months. Consider switching to an electric toothbrush. Brush for 2 full minutes, twice a day. Floss nightly, no exceptions. And never skip your dental checkups, even if you have dentures. Your mouth could be warning you about something serious. The question is, are you listening? Mistake number 2. Infrequent bathing and ignoring skin changes. Let's be honest. As we age, many people begin to bathe less often. Maybe it's because mobility is harder or the skin feels drier, especially in colder months. But here's the danger. Reducing how often you bathe can hide some of the earliest signs of serious internal health problems. Your skin is the largest organ in your body, and it often shows signs of illness before any blood test ever does. Dermatologists at the Mayo Clinic have found that subtle skin changes can reveal early-stage diabetes, liver dysfunction, and even heart trouble. Consider Clarence, a 7-year-old former postal worker. He believed that bathing once a week was perfectly fine, especially since he wasn't sweating much. But during a doctor's visit, his physician noticed odd skin discoloration that Clarence had overlooked. It turned out to be a warning sign of kidney disease, something that could have gone undetected for months if not for that routine skin check. If you've been bathing less often, thinking it's no big deal, now is the time to reconsider. Frequent, gentle bathing not only keeps the skin clean, it allows you to spot warning signs, discoloration, dryness, patches, irritation. These aren't just cosmetic concerns. They might be your body's quiet cry for help. Will you hear it in time? Mistake number 3. Ignoring nail care. When was the last time you really looked at your fingernails or your toenails? Not just a quick glance, but a true inspection. Because to a trained doctor, your nails aren't just grooming details, they're diagnostic clues. The American Academy of Dermatology has found that nail changes, thickening, yellowing, ridges, or dark spots can signal over 20 different systemic illnesses, including thyroid disorders, anemia, heart disease, and even early signs of cancer. Yet most people over 65 simply chalk up those changes to getting older. Beatrice was 82 when she noticed her toenails growing thick and yellow. She stopped wearing sandals, didn't mention it to anyone, and figured it was just part of aging. But foot pain finally led her to a podiatrist. who immediately diagnosed a long-standing fungal infection. The real shock came when blood work revealed her immune system was severely suppressed, and a deeper condition had gone undetected for months. The truth is, your nails may be sending you messages about your circulation, your nutrition, even your overall immune function. Don't ignore changes in color, shape, or strength. They're not just about appearance. They're your body's silent indicators of something deeper. Look closer. Your health could depend on it. Mistake number 4. Improper incontinence management. This is one of the most common and most quietly hidden hygiene issues among older adults. And yet, it's also one of the most dangerous. Over 50% of seniors experience some form of incontinence, but few ever talk about it. Why? Embarrassment, shame, fear of judgment. But trying to manage it alone, in silence, can have serious health consequences. Douglas, a 73-year-old retired accountant, began noticing occasional leakage. He didn't want to mention it to his doctor, not even to his wife. He used paper towels, changed his clothes more often, and hoped no one noticed. But over time, the irritation turned into open sores. Eventually, he couldn't hide the pain. When he finally saw a doctor, the diagnosis was sobering: an advanced prostate condition that could have been treated months earlier had he spoken up. Johns Hopkins urologists warn that untreated incontinence can lead to dangerous infections, falls, and even mask signs of bladder or prostate cancer. It's not just part of aging, it's often a red flag for something more. If you're experiencing any symptoms, even mild ones, don't wait. Speak to your doctor. Use proper, medical-grade hygiene products. Change them regularly and follow a cleansing routine to protect your skin. Hiding the problem won't help. Addressing it could quite literally save your life. Mistake number 5. Dangerous ear cleaning habits. Let's talk about a hygiene habit that seems harmless, but can lead to permanent damage: ear cleaning. If you're using cotton swabs or any small object to clean inside your ears, especially deep into the canal, you're not helping your hearing. You could be hurting it. Many seniors were never told just how risky this habit is. Patricia, a 71-year-old retired librarian, used cotton swabs her entire life. She believed she was being hygienic, careful, responsible. But one day, she pushed just a little too far. She felt a sharp pain, then a ringing sound. She had punctured her eardrum. The infection that followed not only damaged her hearing permanently, but spread into nearby tissue and required emergency care. No one had ever told her that cotton swabs weren't meant to go inside the ear canal. According to geriatric ENT specialists, nearly 40% of ear injuries in older adults come from improper cleaning. And here's the kicker: most of them were entirely preventable. The safe approach? Never insert anything into your ear canal, not even a Q-tip. Clean only the outer ear with a warm, damp cloth. If you feel like you have excess wax, don't guess. Use over-the-counter ear drops or speak with your doctor for safe removal. Hearing loss often begins slowly and silently. Don't let a well-meaning habit turn into a lifelong consequence. Mistake number 6. Poor foot hygiene. Your feet might not be the first thing you think about when it comes to personal hygiene, but for doctors, they're often the first place they look. That's because your feet reveal critical information about your circulatory system, your nerve health, and your immune function, all without saying a word. Yet many older adults go weeks, even months, without properly washing, drying, or checking their feet. Take Raymond. He was a 76-year-old retired factory worker who assumed the dry, cracked skin on his heels was just a normal part of aging. He applied lotion every now and then, but didn't pay much attention. During a routine exam, his doctor removed Raymond's socks, paused, and immediately ordered blood work. The result? Early-stage diabetes caught just in time. Studies from the American Podiatric Medical Association show that up to 85% of diabetes-related amputations could be prevented with proper foot care and regular inspection. Let that sink in. Wash your feet daily, thoroughly. Dry them completely, especially between the toes where fungus hides. Check for sores, discoloration, or numbness. And don't dismiss minor wounds that won't heal. Those can be serious warnings from your body. If you notice something unusual, don't wait until it hurts. Get it looked at. Because sometimes, the most important signals about your health are right at your feet. Mistake number 7. Medication-related hygiene changes. Are you taking multiple medications? If so, here's something few people, and shockingly, even fewer doctors talk about. Your prescriptions might be changing your body's hygiene needs in ways that could be dangerous. Barbara, a 7-year-old retired nurse, started noticing something odd. Despite bathing daily, she developed a persistent body odor, one that deodorant couldn't cover. Her family thought she just wasn't washing well enough. She felt embarrassed, confused, and even started avoiding social events. It wasn't until her geriatrician asked about recent medication changes that the truth came out. The odor wasn't poor hygiene. It was a sign of liver toxicity caused by a drug interaction. Pharmacologists from the American Geriatric Society report that nearly 40% of adverse drug reactions in seniors first show up as hygiene-related changes, things like dry mouth, unusual sweat, or altered body odor. Here's what to watch for. If you start a new medication, track any changes in body odor, sweat patterns, or dryness in your skin or mouth. Keep a simple journal. And never assume these are just aging. They could be early signs of something your body is struggling with, quietly but urgently. Stay hydrated. Report any odd hygiene changes to your doctor immediately, and never adjust your medications on your own. Your prescriptions may be saving your life, but only if your body can handle them. Fixing the 7 hygiene mistakes is a powerful start. But what if you could go even further, with just a few small daily changes? Let's talk about 3 easy habits that can quietly transform your health and hygiene as you age. First, switch to a hygiene checklist. It may sound silly, but studies from the National Institute on Aging show that seniors who use a simple daily hygiene tracker, brushing, skincare, nail check, hydration, are 2x more likely to spot problems early. Stick it to your bathroom mirror. Make it part of your morning ritual. Second, create a doctor notes journal. Every time you notice something new, a rash, a change in smell, dryness, bleeding, or pain, write it down. Bring that journal to your next appointment. Most health issues become dangerous because they go unnoticed for too long. And third, talk to someone you trust. Many seniors feel embarrassed to mention hygiene issues. But silence is the enemy of prevention. Whether it's a doctor, caregiver, or friend, having someone you can talk to might save your life. Now you know the 7 hygiene mistakes that doctors notice immediately in seniors, and a few simple habits that could make all the difference in catching serious conditions before they start. Remember, this isn't just about staying clean. It's about protecting your independence, your dignity, and your health as you age. And sometimes, the smallest daily changes are the ones that save lives. If you found this video helpful, please take a moment to hit that like button. It really helps more people see this important information. Have you or someone you love experienced a hygiene-related health scare? Share your story in the comments below. You never know who it might help. And don't forget to subscribe and tap the notification bell. We've got more life-saving tips, senior health advice, and little-known strategies coming your way. Take care of yourself. You're worth it.